Good morning. So it's been 24 hours since I had my operation and spent the night in the hospital. I thought I was in a hotel because it was so comfortable for me. The food was delicious. The nurses and everything were very attentive, and I was very comfortable. And here it is, 10 o'clock in the morning the next day, and I had my right hip replaced. And as you can see, it's really no pain. I'm on a lot of Tylenol and so forth because I'm in a hospital, but it feels very strong, feels very solid, and I need a week or so of resting, taking care of myself. But it's really not it's a far cry from the last year I've spent hobbling around on a terribly arthritic hip joint, which even with heavy anti-inflammatory medicines still hurt with every step, and I was afraid of tripping and falling. And when you work in New York City and you get around, it's very treacherous. So now I just need to take care of myself and let my body adjust. But really, it's the idea is that there's no pain. Now I'm sure it's going to be throbbing, and I'm sure I'm going to be having to take it easy for a week or so. But point is that I'm walking fine. There's no pain. I mean, I don't feel like I'm going to fall. I feel very stable. I mean, I'm comfortable. So this is like why you come to Phelps Hospital. This is my second hip, by the way. 14 years ago, Dr. Seebacher did my left hip. It was a different procedure. Fine. I was in the hospital 9 days. Went home, a lot of physical therapy because they cut the muscle, whole big thing. Fine, done. 14 years later, I came back as my right hip started to hurt. It was different. This was an arthritic hip. This was bone on the left. So this arthritic hip was a little more elusive in the x-rays. But Dr. Seebacher wanted Dr. Hochfelder, his colleague, to perform the surgery. And so we talked for about 4 to 6 months about when and how best to do it and so forth. And I watched my hip become more and more debilitating. And finally we said, okay, let's get it done in February of 2018. And here I am. I checked in yesterday at 6 in the morning. They were operating at 7:30. 11 o'clock, I was in the pre-op room, and here I am. I mean, I could go back to my normal life.